Hello everyone, welcome back to General Embryology sessions. So we shall continue with intraembryonic mesoderm. We have already heard about this during gastrulation, during the formation of trilaminar germ disc. So today we are going to see little more in detail about intraembryonic mesoderm and its derivatives. So the cells of the primitive streak, so here we know this is the primitive streak. So the cells of the primitive streak, they invaginate towards the endoderm and forming a groove which is called primitive groove. And from the bottom of this groove, the cells of the primitive streak, they spread in between the endoderm and the ectoderm to form intraembryonic mesoderm. So the red color cells, what you see here, sandwiching between the ecto and endoderm, are the cells forming intraembryonic mesoderm, which is a third germ layer. And most of this mode of the spread of this intraembryonic mesoderm, it has got a particular pattern that it spreads in the cranial and the caudal and lateral directions to all parts of the embryonic disc except in three regions. So the region where the procaudal plate is present or oropharyngeal membrane is present, where ecto and endoderm are directly in contact with each other without intervening mesoderm. And the second point, we already heard about this cloacal membrane too, where ecto and endoderm are in direct contact with each other without intervening mesoderm. So the buccopharyngeal membrane is the area where the procaudal plate is formed. So where we see the ecto and endoderm are in contact. The region of cloacal membrane, which is a circular area caudal to the disc, and here also we know ecto and endoderm are in intimately contact with each other. And there is third region where the intraembryonic mesoderm is absent, that is the site of notochord. So the region of notochord, so the midline between the procaudal plate and the primitive knot. So this is the procaudal plate and here is the primitive knot. We see the midline, the development of notochord. So this area, it is occupied by the notochord. So that is the reason there is no intraembryonic mesoderm there. And anterior to the procaudal plate, this is the procaudal plate or oropharyngeal, anterior to the procaudal plate, we see the mesoderm, it is continuous with each other. And the mesoderm, it in this area, it forms the septum transversum. So anterior to the procaudal plate, the mesoderm is continuous with each other to form the septum transversum. So as the embryonic disc enlarges and elongates, the connected stalk becomes narrow, smaller, and comes to lie on the caudal side of the embryo. So at the caudal end of the embryo, the intraembryonic mesoderm passes beyond the embryonic disc and becomes continuous with the mesoderm of the connecting stalk, which is made up of extraembryonic mesoderm. So that was about a little introduction and where and all it is present. Now we will see the further subdivisions of intraembryonic mesoderm. So we see intraembryonic mesoderm on the either side of the neural tube. So here is a schematic image for you to understand, showing the coronal section. So this is the neural tube here. So on each side we can divide the intraembryonic mesoderm into three parts. So the medial one is the paraxial mesoderm. Paraxial mesoderm undergoes segmentation later on to form somites, and the intermediate mesoderm, which gives rise to urogenital system, and lateral most is called as the lateral plate mesoderm, which is grooved on each side, we can see, and this groove later gets deepened, forming a cavity which is called as intraembryonic coelom, and which splits the lateral plate mesoderm into a layer surrounding the yolk sac, which is called as splanchnopluric intraembryonic mesoderm, and the other layer which is along the amniotic cavity, which forms along the body wall later on, that is called as somatopluric intraembryonic mesoderm. So these are the two subdivisions of lateral plate mesoderm. So in previous slide we have seen the three parts of intraembryonic mesoderm which are present on each side of the midline, that is paraxial, intermediate and lateral plate mesoderm. Whereas the mesoderm which is in the midline, just below the surface ectoderm, where we see the notochord, that is called as axial mesoderm. So the notochord and precaudal plate develops from the mesoderm arising from the cells directly through the primitive node, and they migrate cranially through the midline. So some say notochord is a part of axial mesoderm, but some authors considered it is just a protrusion from the primitive streak itself, so nothing to do with the mesoderm. So notochordal and notochord plate and even the precaudal plate are important signaling centers that pattern the overlying ectoderm and underlying endoderm. So that was about the axial mesoderm. Let us discuss about paraxial mesoderm. Paraxial mesoderm, which is the mesoderm lateral to the neural tube, it condenses to form a paraxial mesoderm, and which undergoes segmentations to form somites. And lateral most are the intermediate and the lateral plate. So intermediate mesoderm, this is the paraxial mesoderm is here. This one is the paraxial mesoderm. This is the paraxial mesoderm. Here is the intermediate mesoderm, and this is the lateral plate mesoderm. So the intermediate mesoderm, it is not only the intermediate in position but also intermediate in thickness as compared to paraxial and lateral plate. And next about the lateral plate mesoderm, the mesoderm is in the lateral part of the embryo, embryonic disc, and it remains thin and forms the lateral plate mesoderm. And paraxial mesoderm undergoes segmentation to form somites, that are somatomeres and somites. And the development of somatomeres, that is the paraxial mesoderm, it forms like a longitudinal columns of mesodermal cells that lies on each side of the notochord and neural tube, and developing they forms later on vertebral arches around the neural tube. So the paraxial mesoderm, which is like a longitudinal column of mesoderm, after undergoing segmentation, the somatomeres, they are just formed, that segments are formed from the craniocaudal sequence. So the first pairs of somatomeres appears in the cephalic region of the embryo, and their formation proceeds from cranial to caudal side, and each somatomere consists of mesodermal cells arranged in concentric whorls and around the center unit, and there are somatomeres 1 to 7 are located in the cephalic to aortic vesicle, and which do not condense to form somites but contribute in the formation of mesoderm of head and neck region, which forms all striated muscles of head and neck region, skeletal muscles of head and neck region. The remaining somatomeres located caudal to the aortic vesicle condenses to form a well developed segments or cubical blocks which are called as somites. So cranial to the aortic vesicle, somatomeres doesn't form somites. They form mesoderm of head and neck region, giving rise to skeletal muscles. And below the aortic vesicle, they form the segments to form somites. Here is the note. See somites on each side. And we can see the sclerotome having the dorsal component, ventral component, and also the lateral component. So this is the number of somites based upon the approximate age of the embryo. So we can see the aortic vesicle here, Cranial to the aortic vesicle, the paraxial mesoderm doesn't form somites, where it forms a somatomere and later it forms a skeletal muscles of head and neck region. Caudal to the aortic vesicle, we see the somites, which are the cubical blocks of mesoderm located caudal to the aortic vesicle on each side of the developing neural tube. And we can see the first pair of somites which appear just caudal to the aortic vesicle and aortic placoid, and so subsequently the pairs of somites appear from cranial to caudal. So the cranial somites are the oldest somites and caudal somites are the newly formed somites, and around 38 pairs of somites appear between 20th to 30th day of development, which we saw in previous slide. And by the end of the 5th week, about that is around 42 days, there would be around 44 pairs of somites are formed in the human embryo, and out of these 4 are occipital somites, 8 are cervical somites, 12 thoracic, 5 lumbar, 5 sacral, and 8 to 10 coccygeal. And somites form a visible surface elevation on either side on the midline of the embryo. So further we can see the intraembryonic mesoderm here. So this is the neural tube, neural crust cells, paraxial mesoderm, intermediate lateral plate. Until now we discussed about the paraxial mesoderm, and let us continue with the intermediate mesoderm. So intermediate mesoderm is a narrow strip between paraxial and lateral plate mesoderm, and it divides into many segments. It forms most of the genitourinary system. So it forms kidneys, testes and ovaries. And the mesoderm, which is anterior to the procaudal plate or buccopharyngeal membrane, they are continuous on each side. So both the sides are continuous. A large initial small cavities will appear, and these cavities will fuse to form a large cavity which is called as intraembryonic coelom. So all these cavities, we know they coalesce and together they form a large horseshoe shaped cavity which is called intraembryonic cavity or coelom. And subdivisions of intraembryonic coelom, if you see, so during second month the intraembryonic coelom is divided into 3 parts, which we are going to see in next image. So here we can appreciate this is the paraxial mesoderm forming somite, and this is the intermediate mesoderm, and here is the lateral plate mesoderm, which is along the ectodermal cells will form somatopleuric, and which is along the endodermal cells will form splanchnopluric. Let's see the subdivisions. The part anterior to the procaudal plate called as pericardial cavity. So this is the future pericardial cavity. So here the procaudal plate cranially. So anterior to the pericardial plate, procaudal plate is called as pericardial cavity. And right and left limbs of intraembryonic coeloms are called as peritoneal cavities. On each side it forms the peritoneal cavity. So this is future peritoneal cavity is here, this is on each side. And canals through which the pericardial cavity communicates with the peritoneal cavity are termed as pericardio-peritoneal canals. So the canals through which the pericardial cavity communicates with the peritoneal cavity is called as pericardio-peritoneal canals. So these are the 3 things to be known. So the space between these layers becomes the body cavities, that is the coelom, and that stretches from the future neck region to the posterior of the body. So during later development, eventually the right and left side coeloms, they fuse and folds of the tissue extends from the somatic mesoderm, dividing the coelom into separate cavities. The coelom is divided into pleural cavity, pericardial cavity, and peritoneal cavities. So pleural cavity is enveloping thorax, and the pericardial cavity envelops the heart, and peritoneal cavities envelops the abdomen. So parietal layers of the pleura, pericardium and peritoneum, they are all derived from the dorsal somatic lateral plate mesoderm. Whereas visceral layers of pleura, pericardium and peritoneum, they are all developed from the ventral visceral lateral plate mesoderm. So somatopleuric lateral plate mesoderm will give rise to parietal layers. Splanchnopluric or visceral lateral plate mesoderm will give rise to visceral layers. So this thing to be noted. So this is the somatopleuric, this is splanchnopluric lateral plate mesoderm, and we can see the intraembryonic cavity separating these two layers here. And this is ectoderm. Along the ectoderm we find the somatopleuric, and along the endoderm we find the splanchnopluric. So this concept to be noted. So final chart here to understand the derivatives of all the germ layers. So here we can see ectoderm. Ectoderm divides into neuroectoderm and surface ectoderm. Neuroectoderm will form central nervous system, retina and perineal body and posterior pituitary gland, and neural crust cells, which are also derived from the neural ectoderm. They form the cranium of the skull, connective tissue, dentine, pharyngeal arches, most of the connective tissue of head and neck, sympathetic and parasympathetic ganglia, all this. And odontoblast, squamous cells, all these are derived from the neural crust cells. Surface ectoderm will form the epidermis, hair, nails, cutaneous and mammary glands, anterior pituitary gland, pars intermedia, enamel of teeth, internal ear, and corneal epithelium and lens of the eye. So they are all derived from surface ectoderm. Then mesoderm, today we studied about intraembryonic mesoderm dividing into paraxial, intermediate, lateral plate. Paraxial mesoderm will form the skeletal muscles of the trunk, limbs except the cranium, muscles of head, and also it forms the dermis of the skin, connective tissue, vertebra. Intermediate mesoderm will form urogenital system including gonads, ducts, accessory glands and adrenal glands. Lateral plate mesoderm forms the connective tissue and muscle of the viscera, serous membranes of pleura, pericardium, peritoneum, and blood and the lymph cells, cardiovascular and lymphatic systems, and also the spleen. These are all derived from lateral plate mesoderm. Finally, the endoderm. Endoderm forms the epithelial lining of respiratory tract, gastrointestinal tract, urinary bladder, and epithelial parts of thyroid gland, tympanic cavity, auditory tube, tonsils, parathyroid gland, liver, pancreas. They are all derived from the endoderm. So this is a chart where we can understand derivatives of all three germ layers. So let us see some questions associated with this germ layers. So all developed from mesoderm except. So see the answers: skeletal muscles, testis, enamel, ureter. So I hope you would know the answer. Enamel of the teeth develops from surface ectoderm. Rest all derived from the mesoderm. Ureter is from intermediate mesoderm, testis is from intermediate mesoderm, and paraxial mesoderm gives rise to skeletal muscles. All are derived from the mesoderm except pupillary muscles, skeletal muscles, smooth muscles, extraocular muscles. So remember, pupillary muscles are not derived from the mesoderm. The iris, the pupillary muscles of the iris, they are derived from the ectoderm. So they are the only muscle in the body which is derived from the ectoderm. Rest all muscles are derived from the mesoderm. So this completes the intraembryonic mesoderm. Along with the intraembryonic coelom, we saw that, and also the derivatives of all three germ layers. Thank you.